WellFort has seen a year-over-year increase in the number of patients not achieving expected positive health outcomes. We've engaged our patients in dialogue to further explore the root causes of why this is occurring. The results were both shocking and disturbing. They revealed that they frequently had to make a choice between filling their prescriptions or filling their bellies. They further reported that there were times when, in order to get much needed medication, they would be required to forego some of the basic fundamental rights. The burden on our primary care providers is significantly increased with the knowledge that their patients are unable to obtain the medication they require to get well. This is an unacceptable situation in a country like Canada. Canada is the only developed country in the world that has a universal health care program, yet does not have a universal Pharmacare program. As a health-based organization, this posed an ethical and moral dilemma for WellFort, one on which we felt compelled to take action. It is time for change. The current system is designed so that people get sick, and they stay sick longer, making them susceptible and vulnerable to further injury and illness. This translates to higher costs and higher demand on other parts of the healthcare system. This demand and cost can be greatly reduced with the implementation of a universal healthcare plan.
My name is Mitesh Patel. There are many people who do not have any private coverage and they are not eligible for the provincial coverage. And there are times that they have to decide not to fill their much needed prescriptions. In many of these cases, patients' health deteriorates and they end up to the hospitals and emergency room. It is difficult to see the sadness in people when they realize that they cannot get their medications which they really needed to be well. As a pharmacist, there is not much we can do to decrease the price of the medication. I can adjust the dispensing fees, but that doesn't do nearly enough to make the medication affordable for most of the needed patients. A definite and positive solution in this dilemma would be the universal Pharmacare for all Canadians. It would decrease the number of visits and admission to the doctor's office, urgent care centers, hospitals and emergency rooms.
I'm a nurse practitioner working with WellFort Community Health Services. We serve people who have low income, who are homeless, underhoused, and newcomers to Canada. Many of our clients face many challenges when it comes to paying for their medications. They have to make sacrifices when it comes to paying for them and sometimes are unable to make those sacrifices. There's a huge impact on people's health when they are not treated with medications for certain conditions. It can result in poorly controlled diabetes, poorly controlled high blood pressure, untreated depression, just to name a few. My philosophy when it comes to primary care, as well as many others, is an upstream approach. We look at health promotion and preventative care. When health conditions are managed, there are fewer visits to primary care as well as decreased hospital stays. This creates benefit to the healthcare system as a whole and produces lower cost.
Change is built on the commitment to a better future.
It is time that Canada step up and invest in universal pharmacare for the health of all Canadians.
It would improve the lives of all Canadians.
Please join us in our commitment by supporting and sharing this Pharmacare campaign. Together, we can be the change.